Namaste. The CITER, Center for Yoga Therapy Education and Research, has been functioning in the Sri Balaji Vidyapith University since November 1, 2010. CITER is an innovative center. It is a center focusing on salutogenesis, all the causes and the methods to maintain, sustain, and attain health in the individual.
The innovative focus of CITER is on salutogenesis, the concept of health promotion and disease prevention and management that enables us to work towards the holistic health and well-being for all. All students of the constituent colleges of Sri Balaji Vidyapith are exposed to the yoga training on a regular basis.
Yoga, the ancient art and science given to us by the Indian civilization, the gift to the entire humankind, is being propagated through Sri Balaji Vidyapith in an innovative manner. Here at CITER, because we are in a healthcare medical institution, we are able to serve those patients who are suffering from various psychosomatic, lifestyle, stress-induced disorders. Patients at our hospital, the Mahatma Gandhi Medical Hospital here, they get the yoga therapy as part of the entire treatment protocol. A patient with diabetes would get the diabetic management of modern medicine, and in addition, the adjuvant therapy of yoga along with it. Similarly, we are doing work in psychiatry, we are doing work in dermatology, neurology, neurosurgery, and of course, obstetrics and gynecology. At CITER, we are focusing on three aspects: therapy, education, and research.
Yoga is the greatest contributions of India to entire mankind of the world. Recently, the government of India is currently promoting indigenous system of health, including yoga, in strong manner through the Ministry of Ayush.
As a therapeutic center in a medical institution, we have given yoga therapy as individual, small group, and larger group settings for more than 52,000 patients in the last 9.5 years. We have looked at giving them an opportunity to heal themselves, facilitating the self-resilience and self-healing mechanisms through adjuvant yoga therapy. Along with this, we have done extensive research. The research in the form of 19 completed projects, 88 publications, 31 abstracts, and 9 copyrights in the name of Sri Balaji Vidyapith.
CITER has contributed to many best practices that are innovative, and 9 of these have received copyright registration in the name of Sri Balaji Vidyapith, and 3 of them are very close to our heart because we address the neglected sectors of the population through these best practices. One for the special children through the Divyanga Yoga, and second one for the senior citizen of the society through the Silver Yoga, and third one to the transgender population through the salutogenic approach to the transgenders. And through these, we are alleviating the problems, many of their problems which have not been addressed through the yoga techniques, through the various aspects and concepts of yoga. We are able to reach out to them through these practices and techniques.
I am Dayanidhi, working as a yoga lecturer at CITER SBV. I am really happy to doing my PhD yoga therapy at CITER. Here we have a hands-on experience with patients coming from various departments. Also, we can go into different wards even ICU to giving yoga therapy for the various kinds of patients. And here, SITER, we can build a connection between modern science, allopathy, with the ancient science, yoga.
Looking into the hows, whys, and the mechanisms of how yoga therapy enhances healing, facilitating a state of health physically, emotionally, mentally, socially, and even spiritually. We are very unique because we can offer different yoga therapy academic programs under the banner of Sri Balaji Vidyapeeth.
SITER has started various programs such as diplomas, postgraduate certificate programs, MPhil programs, as well as PhD programs in yoga. In addition to that, in the field of academics, for the first time, we have introduced yoga therapy in the curriculum of nursing college in our institute.
Our therapy programs are ranging from PG certificates in yoga as a therapy, PG diploma in yoga therapy, MPhil in yoga therapy, all the way up to the PhD in yoga therapy.
Hi, I'm Ellie Wilson. I'm visiting from Australia. I am doing an internship with SITER. I've had many amazing experiences working in the hospital, in the neurosurgery department, neurology, and recently general surgery.
Numerous students have graduated as yoga therapists, becoming the first to come out of this innovative is one of the rare centers in the whole world where yoga therapy is part and parcel of the day-to-day activities of a medical institution. Our patients benefit from yoga. The students of Sri Balaji Vidyapeeth, whether they are medical, dental, or nursing, they are exposed to yoga as part of their curricular and extracurricular activities. This is truly one of its kind center in the world, and we thank the international community for its support for all our activities. We thank the benevolent management of Sri Balaji Vidyapeeth, the visionary administrators who enable us to do our best to bridge the traditional system of yoga with modern medicine.
Promotion of yoga in the society, among the students, among the people, and will keep our flag of SBB flying very high.
As the World Health Organization is saying today, traditional, complementary, integrative medicine is the future of medicine. And SITER is striving to achieve that future right today, along with your wonderful cooperation. Thank you so much. Namaste, Vanakkam, Swagatam. Welcoming everyone to day 2 of our SBB IDY 2021. And such a pleasure to have such eminent, great
sons of Mother India with us today. I, at the outset, welcome Dr. Selvamurthy ji, who's with us, and welcoming Seduraman sir, welcoming Ramareddy sir, my dear Sangeeta, my dear Veena, Daya, and others, and all the participants to today, the second day of this week-long webinar, the Yoginar. Let us begin with a prayer, as is the tradition in yoga. Sahana Bhavatu Sahanau Bhunaktu Sahabhiryam Karvavahai Tejasvinavadhitamastu Ma Vidvishavahai. Om Shanti 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 Om. On behalf of Sri Balaji Vidyapeeth, SITER, our whole Sri Balaji Vidyapeeth family, and our international yoga community, we welcome everyone to the second day of SBV IDY 2021. Today, we are truly blessed because we are going to be having an opportunity to listen to two most amazing stalwarts who are inspirational human beings. And the first of them today will be Dr. Selvamurthy ji, and the second today will be Professor K.R. Seduraman ji. Right from my childhood, from the time I was a very small boy, I recollect the beautiful meetings of Dr. Selvamurthy ji with my own father, Swami Geethananda Giri, Ammaji Meenakshi Devi Bhavanani, and the interactions they had when he was at DIPAS in Delhi as the director, and then sir went on to become the chief controller of DRDO. And despite all these high achievements of Selvamurthy sir, he remains one of the most humble human beings on this planet. And he reminds me by his very presence that one of the sure signs of greatness is humility. Humility is one of the sure signs, the thumb rules of greatness. And today he is with Amity University. As he likes to say, it's Amity Universe, not university. And I love that phrase. And I would like to make a special personal mention here that he was a dear friend of our former People's President, Dr. Abdul Kalam sir. And both of them had such a great friendship over so many decades. And when Abdul Kalam ji used to be in Rashtrapati Bhavan, Selvamurthy sir and him used to go and sit together, not to discuss science and all, but to sing together. And they used to sing together, and one of the most famous songs, Arupadi Veedu Konda Tirumuruga. What a beautiful song that Abdul Kalam ji loved, and Selvamurthy sir, I remember last time in Pondicherry, sang it for Ammaji. This is the type of human being we need to have as a role model. He has so many scientific research works. If you look at his scientific research works, they are innumerable. But what is more important is who he is as a human being. That is the most important aspect. We often forget that a human being's biodata goes with who they are in the present moment. And though he is the president Amity Science, Technology and Innovation Foundation, he is the Chancellor Amity University, Chhattisgarh. He has served in DRDO, Government of India for 40 years. He has been awarded the DSC from 5 universities. Okay, mind you, 5 universities. He has done amazing research work over the years. Amazing research work with so many amazing findings. But you know what is more important than all of that is when he is present in the moment. He is not in yesterday, he is not in tomorrow. Because when you are in the past, you are depressed. When you are in the future, you are anxious. The only time you can be healthy is in the present moment. And so with this brief introduction, I would like to welcome Sir. And before that, I see on the screen our dear inspiring mentor, Professor K.R. Seduraman Sir, our former Vice Chancellor at SBB, who along with Selvamurthy Sir had signed an MOU many years ago while both of them were here today. And today we have both on the same screen at the same time. So welcoming you, Sir, such an inspiring role model. And I will give my personal introduction to you before your speech because I have a lot to say. I have a lot to say.
Keep it very short because I have a long talk.
That is your humility, sir. That is your humility. So with these words of introduction and welcome, I offer my deep pranams to Dr. Selvamurthy, sir, and I request you at this time to come into your presentation for today.
Thank you so much, Yogacharya Dr. Ananda Balayogi, whom I have known from his childhood. I have seen you growing and how you have really inherited the...
Sir, for some reason, your mic doesn't seem to be coming.
Is it okay now?
Some audio settings, because it says you're unmuted.
Yogacharya, can you hear me now?
Yes, sir. Yes, now it is fine, sir.
Okay. So first of all, pranams to all the participants who have joined us here today. And so when I see Dr. Yogacharya, Dr. Ananda Balayogi, I get my pleasant memories of my association with his father, a great soul, noble soul, who in spite of his origin from the western side part of our globe, but he was really a true Indian. And he promoted Hinduism, yoga, and also all values of Vedic knowledge through the Anand Ashram. So I would first of all like to pay my tributes and pranams to the departed noble soul and the sanskars, values you have inherited, and the way you have promoted yoga and inheriting all his traits, values, sanskars. You are rendering a yeoman service to the humanity through your Anand Ashram, and also your mother, Srimati Meenakshi Devi Bhavani, whom I had interacted with on many occasions, including the recent one in Vigyan Bhavan, couple of years ago when she had come to a function with you. So the whole family is dedicated to yoga. So that is why my, first of all, pranams to all the family members of Yogacharya Dr. Ananda Balayogi. And so this sanskar and also it should be transmitted to your next generations, which I'm seeing it happening as I visited your home just I think 2 years ago when I visited your home, also sang some devotional songs which you mentioned. So please continue this noble mission because God sends people with a mission. So Dr. Ananda Balayogi, you have been sent with this mission of uniquely promoting yoga therapy on a scientific way, on a scientific pedestal. Now looking at the physiological, biochemical, psychological, clinical aspects of yoga, besides the philosophical aspects, which is important. Because yoga is just not only to keep good health, it's much beyond. That's the first step. Then ultimately to realize your higher consciousness, achieve higher consciousness. That is the purpose of yoga. So the first step is how do you keep your health good so that you are able to focus on yourself and look inward. So that gives the opportunity to raise yourself. So that is the purpose, and to unite yourself with the universal self, unite the body and mind, and also unite the self with the universal self. So with this, I once again thank you, Dr. Ananda, and I see great the visionaries who are contributing in the field of yoga, Dr. Sethuraman, whom I had the opportunity of meeting on a few occasions, and particularly the one when we signed an MOU with this great organization, and also Sri Balaji Vidyapeeth, which I had the opportunity of collaborating together, and they are also doing a yeoman service in therapy. Yoga therapy has to gain importance. And also a country like ours should focus more on prophylactic aspects. Yoga can prevent disease. I'm a living example. In my 72 years, I have gone around the orbit 72 times. I have never been admitted to hospital even once. So that is because of yoga. 45, 46 years I have been doing yoga, not even once. So I'm not boasting, but touch wood that this is yoga. Yoga is prophylactic. I'll show experimental evidence later, but this is the experiential learning myself. If I have been able to achieve something in life, which Balaji mentioned, Dr. Ananda mentioned, that I achieved this, it's because of yoga. Because yoga is promotive. It brings your latent potentials up and gives you the humility, which he mentioned. So because that is the transformation which one has to experience yourself. It's just not only just showing papers and also preaching, one has to experience it. So that experiential learning, I had the opportunity. So if I have been able to achieve something in life, my cognitive abilities, communication abilities, and also have the positive attitude towards life, that is important. Then you can achieve everything. Your attitude decides your altitude. That attitude is given by yoga. So when you practice yoga, not just only asanas, physical, but you have to do really that yoga, yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, samadhi. So yoga is not one hour practice of asanas, pranayama. It is the way of life. So if one leads the yogic way of life, not just only practice 1 hour asanas, pranayama, you have to, suppose I drink this water, I have to feel the water going inside. My mind is, oh, I have to give a lecture. So then it's not yoga. So that is yoga. My mind is united with the drinking process of that water, gulping it. That is yoga. Living in the present, he mentioned, that is yoga. Skill in action is yoga. So everything is yoga. It's just not only a few asanas, pranayam you practice. Your life has to be yogic way of life. That is what I'm going to tell you. Then I would also present some evidence that how yoga can benefit by physiological, psychological, biochemical, clinical studies, which I have done, and looking at the prophylactic, promotive, and curative potentials. So these three aspects, I have been fortunate to do experiments, but I was in DRDO and now in Amity University. So I will be giving a little glimpse. So Ananda, how much time you have allotted for me so that I should keep myself within that?
Sir, we can go up to 11:30, sir.
Okay, good. I will just share my slides, share my screen. Are you able to see it, Ananda?
Yes, sir.
So I'm going to talk to you about and discuss and have a chat with you subsequently after the presentation at how yoga really leads to holistic health. It's not only physical health, it should have mental health, it should have spiritual health, because human existence is just not only the physical body. We are actually spiritual beings who have come to this world for human experience. So if that is so, the spiritual component of your existence is also important. So when I say holistic health, health of your physique, physical, mental, and spiritual existence. That is what I am going to speak about. And also giving the scientific perspectives, not only just philosophical and Vedantic aspects of yoga, but I'm going to talk about the scientific perspectives of yoga. So compliments to all these yoga masters, whom I saw some of them in the video screen, and the video which you presented on SITER is really amazing. The kind of service that you are doing for the nurses, the doctors, the patients, amazing. Continue this mission, because this is, God has given you this noble mission. Continue this at the Center for Yoga Therapy Education and Research at SBV. And I see all the giants, including Madan Mohan, right from Pondicherry itself, who has been associated with you for years, right from your PhD time, during your MBBS time there in Pondicherry, and also Dr. Bijlani, Dr. Satish Gupta, with whom I'm going to show some experiments which we have done together. And also I see our this director of MDNIY, I see here. So all these people who have contributed not only at the national level, at the global level, on the science of yoga, the therapy, yoga therapy, they have contributed. So my salutations to all these great stalwarts who have contributed and who are rendering human service. So on this occasion of the Yoga International Day of Yoga, which is being celebrated for a week since yesterday, because Dr. Ananda, I was just now, Jagat Guru Dilip Ji Maharaj is giving a lecture. He said yesterday he was with you at the inaugural. Yes. So he mentioned about you. And so I was very happy. And he is giving a lecture at Amity University. So I have come here to give a lecture to you. So he is giving the concluding lecture there, valedictory. This COVID-19 has really brought unprecedented challenges. I think in our lifetime, I haven't seen in my 72 years such an unprecedented challenge, which is it has posed to all of us in all walks of life, whether it is education, whether it is the economic or the health challenges, and many, many more, the psychological challenges. So there are about, it's believed that 200 million people experienced mental disorder because of this lockdown, isolation, monotony, separation from family, fear of the unknown, everything impinging on this human soul. So many people have been afflicted with the mental challenges of the depression, anxiety, and insomnia, many, many other manifestations of mental disorder. And so the challenge is fear of contracting, whether I will get it at any point of time, even if you don't have right now. Working from home, which you are not used to, where you have to look at the home as well as the office, challenge. And then also some people were laid off their jobs, unemployment, and school children who are stuck to the screen instead of moving around, chatting with the children, other children. So these are all the challenges which led to unprecedented challenges in our lifetime. So if we have to care for the 7 billion people, including 1.37 billion people in India, we should focus, if you have to convert them into an asset, not a liability, then you need to focus on 3 aspects: the healthcare, education, occupation, healthcare. So this is the triangle. So if you are not healthy, you can neither have a quality education or you can be productive in your occupation. So the health has a pivotal role in this triangle. So health has a pivotal role. That is why this webinar is important. This 1 week or 5 days celebration, which will focus on the health aspects of yoga, is important. So yoga is prophylactic, promotive, and curative, and which will keep you to acquire the quality education and be productive in your occupation. So why it is important to our country? Advantage India is demographic. One is the young India, the population below 50% below the age of 25 years. And the other challenge which we have, how do you give? We cannot build so many hospitals, so many tertiary hospitals and healthcare centers. So inequity in healthcare, how can we fill it? It's a big challenge. Inadequate health infrastructure. How many hospitals you can build? How many doctors you can train? You cannot have each individual, one doctor for each individual. So all these are challenges, and also our people literacy level is also low, and we live in dense population. So these are all challenges because with a large population, 1.37 in a limited area spread out, and that again brings challenges. So the awareness is not there about the positive health. So how do we give it through the education, including yoga education? So we have focused. Ministry of Health has established Ministry of Ayush. Now the government of India has established a separate ministry for Ayurveda, Yoga, Unani, Siddha, Homeopathy, and particularly focusing on yoga as a way of living. And the International Day of Yoga, thanks to Honorable Prime Minister, who has taken yoga to an international community, Shri Narendra Modi ji, has really put yoga on a global map. Since 2015, International Day of Yoga is being celebrated. So salutation to this great Honorable Prime Minister, who has really taken it to the global level, thereby creating a new India, thereby creating a new world. So that is why this day of celebration is important. Celebration is not just to practice yoga on this 1 week or 1 day. It is to promote that how do you make this a part of your life? To have health, happiness, peace, global harmony, everything what you would desire in your life to look at, and the world you want to look at, you can create through yoga. So that is why this International Day of Yoga is very, very important for all of us. And this is being practiced across the globe, so I don't have to say much about this. And now, what is the advantage India has in promoting yoga? Because yoga started in our country 5,000 years ago, not just for the International Day of Yoga. It has a root in our genes, in our civilization, in our Vedas, Upanishad, Bhagavad Gita, everywhere it has a root. And there are so many eminent centers, there are more than 300 renowned centers. And now Ministry of Ayush has established a yoga certification board. So all these centers in India and abroad are getting accredited so that there is a quality standard, there is a standardization to some extent, and also a quality education, therapy, and practice is ensured through the Yoga Certification Board of Ministry of Ayush. I am fortunate to be, I have been entrusted with the responsibility of being the chairman of the assessment committee, like NAC chairman. So I am the chairman for the assessment committee of Yoga Certification Board. So I would request the viewers, the members who have joined us today, whomsoever is not accredited yet, please do the accreditation. This will give you a stamp of the Ministry of Ayush, which is essential to have a quality. So there are many centers which I have mentioned, including CITER and the SBV and Morarji Desai National Institute of Yoga. Basava Reddy, Director MDNIY, is the member secretary of this Yoga Certification Board, and the secretary himself is the chairman of the board. And so like this we have, and the assessment committee, I'm there. Now, when you look at so many centers, there are various types of yoga being Raja Yoga and Yes Vyasa. When you look at Yoga University, and he has established now, Dr. H.R. Nagendra has established one in US, in San Francisco, a Yoga University. It's a Yoga University in USA, first time. And it's a great contribution H.R. Nagendra is making. Brahmakumari's Raja Yoga meditation, then Patanjali Yoga. Actually, Dr. Ramdev, Baba Ramdev is promoting yoga in a big way. I see his programs and the testimonials which the patients give, even type 1 diabetes, type 2 diabetes, and I'm seeing it. So he is promoting yoga therapy in a big way, and Patanjali Yoga is again focusing on yoga therapy. The Art of Living, again, Sri Ravi Shankar ji, The Art of Living, which also has got the yogic component as a big part of the Art of Living. So like this, there are many ways you can approach, like Raja Yoga, Jnana Yoga, Bhakti Yoga, Hatha Yoga, Karma Yoga. So you can have all this. So yogic, the Vedic science has got yoga, meditation. You can even put as a dhyana as a part of the yoga itself. Mantra, which you just recited a couple of minutes back, Dr. Ananda. Ayurveda. So all this was to give ourselves a good living, healthy living. So that is what is yoga. And it's just not only just your diet, yogic attitudes. Everything is part of yoga. Just I want to make it clear to all the participants, it's just not only the practicing asanas, pranayam, and meditation is yoga. It is the holistic yoga includes everything. So it started in our country 5,000 years ago. And then now it is becoming the lighthouse for the whole world. So the International Day of Yoga is actually to show that how India is the lighthouse, which can really create a new world, a happy, healthy world through yoga. If you have to understand the yoga, many people come to the SBB, I have seen, and also Ananda Ashram. I used to see many foreigners coming, learning yoga, taking it to the global level. So it has become a destination. Many people come to India to seek knowledge about yoga, Vedas, and the yogic way of life. So that is why I said it's a lighthouse for yogic science as well as yogic practice. As I said earlier, that the first level is to have this physical, mental, and spiritual well-being. Practice of yoga is that first level. Then ultimately, the higher level of achievements through yogic practice and yogic way of life is to have an evolution of yourself, the spiritual self, because we are all Atma, embedded in this body, are living in this body. The temple of your Atma is this body. So that is why the first level of keeping it healthy is very important. Then the next level is how do you elevate your spiritual self? This is the second step of the objective of practicing yoga. And ultimately reaching higher consciousness and moksha, the salvation, is the ultimate aim of the practice of yoga. So it is just not only for good health, holistic health. Holistic health is important. The spiritual aspects comes there. So as I said, these are various types of the practice of yoga. There are various sects. If you have to understand yoga in the real sense, you should understand two concepts. The first is we don't exist only at this Sthula Sharir, the physical body. You exist as Sukshma Sharir and Karana Sharir. So this is one philosophy you should understand, which you can even scientifically prove that if you do a thermography, infrared thermography or Kirlian photography, you see another layer which you don't see with the naked eye. So there is a subtle layer, even if you have to do some scientific evidence that you can show that there is another level of existence besides the physical body which you see with your naked eye. Then the Karana Sharir, if I'm giving a lecture here, there is a purposeful existence of mine at this moment with you, with all of you who are participating in this. So there is a purposeful existence of this body today is to give this lecture. So that is Karana Sharir. Then even the physical body, you might have heard all this Annamaya Kosh, Pranamaya Kosh, Manomaya Kosh, Vijnanamaya Kosh, Anandamaya Kosh. So it exists at these levels. So yogic practice brings a harmony between all these three levels of your existence. Sthula Sharir, Sukshma Sharir, Karana Sharir. And within the Sthula Sharir, it integrates all these 5 layers together. That is yoga. That is the benefit of yogic practice. It's just not only the unification between mind and body, but unification with all these levels of existence is yoga. Now I'm going to focus on 3 aspects: the prophylactic, preventive. Because in a country like ours, we cannot focus on only tertiary healthcare. How many hospitals we can build? So we have to prevent disease. Preventive medicine is important. Prophylactic aspect of yoga is important. So yoga is really prophylactic. I will show how it is. Promotive. You have to bring the best in you. That is health. Holistic health means you are at your best. Your Kundalini Shakti is awakened. That is yoga. So yoga is promotive, whether it is your cognitive ability or decision-making ability, or it is concentration, memory, learning efficiency, psychomotor performance. All these are promotive aspects. How do you tolerate stress? How do you tolerate environmental stress for a soldier living in high altitude? Is promotive aspects of yoga. So this is promotive aspects. We are not talking much, but you have to talk more because the demographic advantage. How do you keep this 1.37 billion people at the best of their ability to acquire knowledge, skills, productive in their jobs? Promotive. So yoga should be introduced at all levels to bring the best in every citizen of 7 billion people. Yoga is curative. It may not be, see, in acute, this is where I want, there is no conflict. There is no contradiction between modern medicine and the traditional medicine like yoga. So, people are creating this, but there is no conflict at all. See, each system has got its own advantage. If you look at the allopathy, it has got extremely powerful diagnostic tools. You can look from man to molecule. You can go right up to the genes and its expressions. So that is the power of your modern medicine or the allopathic system of medicine. You can diagnose to the best accuracy, even occult infections. You can do a pharmacoscintigraphy to see where it has gone, and then where is the occult infection. You can bring it out by imaging. So it is powerful in terms of diagnosis. Similarly, acute healthcare. If you look at acute healthcare, when you have a heart attack, you cannot be just only doing pranayama. It may help you to some extent, but you need to have the ICCU for this patient. So acute healthcare, it is very good. That is where the modern medicine has. Then when it comes to treatment, it is you have to control the blood sugar. So you have to give immediately. If it is 700, then you need to bring it to 100. You need to bring it through insulin injections. But then the treatment, this is control and management of the disease. It is not the treatment. I want to tell you, it is the control and management so that it doesn't shoot up again. But have you treated diabetes using this anti-diabetic drugs and insulin? No, you are only supplementing to manage the disease, not to aggravate and have a secondary and tertiary complications. So this is where our yoga, Ayurveda, traditional system can look at the holistic, because unfortunately the modern system of medicine is that's the system. It looks only at the body, but you don't exist at the body level. You exist at Sukshma Sharir and also Karna Sharir. And so that is where the traditional system. Baba Ramdev, if he claims that it is he is able to treat even type 1 diabetes, it is true. I believe that because I have seen the testimonials given by many people there. So there are, it is possible to treat. This is what CITR is also doing. CITR is doing on various the psychosomatic ailments as well as the non-communicable diseases, and it improves your immunity. So yoga is really, it can be used as an adjunct. Yoga can be used as a complementary system to each system. One has got acute healthcare, diagnostic, powerful. The other one is treatment. It's a powerful way of treating, holistic treatment to uproot the cause, the etiological factor. You can uproot by practice of Ayurveda, yoga, all this medicine. Look at the holistic. Your problem may be in the mind and it is reflected in your heart. So you have to treat that mind as well if you have to really give the holistic healthcare. This is what CITR does, and this is what we all emphasize as yoga practitioners. There is no contradiction, no conflict. It has to actually unite. Again, yoga means to unite, to yoke, to bring harmony. So let us bring a harmony between the modern medicine or allopathic system and the yoga, Ayurveda, and the traditional system. Then the other, so that is what is curative aspects. Now, prophylactic. I won't go into the research, but I will tell you how it can prevent disease. You name any disease, you name any non-communicable disease, you can, or communicable disease, you can attribute to any one of these causes. One is lack of exercise, because our body was evolved to be physically tough. Our ancestors were living in mountains, caves, facing the vagaries of the climatic conditions, hunting for the food, running away from predatory animals. So this body, as per the evolution, was to be like that. But then with the modern living, our system undergo disuse atrophy. Suppose I put a bandage, I had a fracture, I put a bandage here in the hand, and after 2 months when I remove plaster, it will be very weak because I have not used it. I have not used it. So that is what is the disuse at just one. This is what is the disuse atrophy, which I am talking about. So lack of exercise, it can cause cardiovascular disease, it can cause many metabolic disorders like diabetes. So one of the risk factor, the causative factor of disease is lack of exercise. Second is this dichotomy between mind and body, disharmony between mind and body. Mind does some job and body does something else. So there is a dichotomy. So I'll just give an example. Every one of you had breakfast. How many of you really focused on breakfast? Somebody would be reading a newspaper and putting the breakfast food, idli, into your mouth. Or somebody will be seeing TV. So 10 people killed in that Syria firing. So you will be putting. So your mind is involved in that incidence of a tragic incident. Your body is throwing the food inside. Dichotomy between what your mind is doing, what your body is doing, it can cause disease. Because your food has gone inside, so the acid is secreted, hydrochloric acid is poured in, digestive juices are poured in, and not to the extent it has to, but it has come in, so like trypsin and so on. So this is started, but your mind is not active, so your saliva is not secreted. When I look at a gulab jamun or a jalebi, first thing when I saw salivation started. So this saliva will go and neutralize your acid form and keep the pH of the medium inside. Otherwise, hyperacidity, peptic ulcer, then it can, 10 people killed. Then you are eating the food. What kind of the secretions will be there? What kind of peristaltic movement of your intestine will have? So this is where can cause disease. A dichotomy. I'm just giving a simple example of day-to-day living. But like this, our mind is involved in something, body is doing something that can cause disease. Third is stress. Stress is there in all walks of life and all across the cross section of the society, be it a student in a school or a soldier standing on standing guard on the snow-clad mountains, or a farmer tilling the field under the hot sun, or an industrial worker or an executive in an office. Everyone faces stress of some kind or other. So it can cause disease. Stress can be an etiological factor, or it can be an aggravating factor. You already have a disease, it aggravates. Or it could be a precipitating factor. I have a family background. I have a genetic predisposition. It will precipitate the disease. So stress can be etiological factor, precipitating factor, or aggravating factor. So that is why stress is the third cause of the disease. Fourth is pollution. Pollution, air pollution, water pollution, soil pollution, food contamination, all this getting inside. So pollutant can cause cancer, so many diseases it can cause. Then infection, like COVID-19. Yoga is prophylactic against all these 5 causative factors. Yoga is a total exercise, physical, physiological, psychological exercise, breathing. Every component what is to be there in exercise is there. Even those which are not there in the physical exercise is there in yogic exercise or yogic practice. So it takes care of the factor. So like abdominal movement, Nauli Kriya. It may not be there in the physical exercise training at all unless you do certain specific exercises. So yoga is a total exercise. It cleanses your system. Toxins are removed. Oxygen debt is removed. Lactic acid, pyruvic acid, which exists in that system is removed. Your reserves, glycogen reserves, ATP reserves are re-enriched. So lack of exercise is taken care of by this. It's a holistic exercise as well. So the first factor of a sedentary living is taken care of by yogic practice. Second is disharmony between mind and body, dichotomy between mind and body. So yoga brings harmony. So as I said, when I drink this gulp of water, I'm feeling how I it going inside, and I feel that it's passing through esophagus. This is yoga. So when I do a movement like this to Paschimottanasana, I'm conscious of this movement. Not that my mind is thinking what is happening in the office, what is happening here. then it is not yoga, it is acrobatics. So yoga is in each movement what you do, yoga is linked closely with that. You are conscious of your physical movement and your mind is unified with that physical movement. Then it is yoga. So it takes care of the harmony between mind and body, because it becomes a part of your living. When you are eating food, you are not looking at the TV, you are not looking at the newspaper, you are enjoying the color, flavor, and taste of your food. That is yoga. So it brings harmony between mind and body. Second factor is taken care of. Third is stress. Stress management is very simple. Only three steps. Normalize your perception, optimize your reaction, release the stress as early as possible. This is all stress management. Nothing difficult. Now, yoga helps you to normalize your perception. Why are we here? We have come with sanskars, values of janmas which we have taken. All that is coming with the Atma. So what I get, I have to do right karma now so that the next janma I should be all right. So I have come with a bank balance of what I did in previous janmas. So it will happen even if, so I have to do my action, skill in action. So the fruits, I cannot decide because there are many factors which will decide, but ultimately I am responsible for whatever happens to me. I'm responsible. So this philosophy will come, so that normalizes your perception. So you don't find fault. You accept people as they are. You accept things as happen to you every time. So you don't really get stressed at all, because I have done my perfectly. I have put 100% of my effort in this, but the fruits are many other extraneous factors will decide. So why do I worry? So it gives that philosophy of karma. So it normalizes your perception, and it makes you understand that you are responsible for whatever happens to you, nobody else. So this philosophy is enough to reduce your stress. So it normalizes your perception of your philosophy of life. It optimizes your reaction to cope with that stress, because during stress, you need to have arousal, but optimal arousal, not exaggerated arousal, like heart rate jumping from 70 to 150. No, heart rate rises from 70 to 90. So that takes care of the coping up with the stress. So sympathetic arousal, the sympathoadrenal response to stress has to be there. So there is a eustress response happens, not the distress response. So it optimizes your reaction. It doesn't show exaggerated reaction to stress. It releases the stress quickly, because everybody gets up, to activate the system to cope up with the stress. But as soon as that stress is over, you need to bring it back to normal. So how quickly you revert back to pre-stress level will determine how much damage you have done to your system, physiological system. So yoga, because of the parasympathetic tone, vagal tone, which builds during the yogic practice, that it strengthens this cooling system of your body, the moon system, the cooling system. So that is how it quickly brings the equilibrium back to pre-stress level. So this is stress management, takes care of the third factor, normalizes your perception, optimizes your reaction, releases the stress quickly, takes care of the third factor. Pollution. You cannot live in BSL-3, BSL-4 facility with kappa filters and all that. So you need to live in the normal environment, be it in Delhi or in Pondicherry or anywhere in the globe. So there, God has given you, blessed you with your own inherent detoxification mechanisms, liver, kidney, spleen, reticuloendothelial system, cilia. All this will take care of your pollutants to a limited level. So yoga strengthens your inherent, God-given, the detoxification mechanisms in your physiological system. That gets strengthened by practice of yoga. Infection. See, infection, again, I said, we cannot be living in that kind of environment to keep yourself free from pathogens. You will be surrounded by virus, bacteria. Today it is COVID-19, tomorrow something else. So you need to put your kavach. That is what yoga does. Yoga gives you kavach for strengthening your cell-mediated immunity, your lymphocytes, neutrophils, and also your CD4, CD8, NK cell, PHA activity. Everything goes up by practicing yoga. There are evidences to show that. So your inherent cell-mediated immunity, humoral immunity are strengthened by yogic practice. That's why you don't get disease. Or even if you get disease, you quickly come out of it. This is what is the evidence which even in the COVID-19, many of the people who practiced yoga were out of this, or they came out with mild symptoms and did not get hospitalized and they recovered very fast. So this is what yoga does. So yoga takes care of all the 5 major causes of risk factors of the disease. So yoga is prophylactic. Now I'll say how yoga is curative. Yoga I have already mentioned the tones of the muscular, skeletal, nervous system, massages internal organs like Nauli Kriya, which doesn't get exercised even in the physical exercise. So it does all this, and also neuroendocrine systems get activated. It brings harmony between body and mind. So all this. So this is how yoga is prophylactic. Now how yoga is promotive. I am going to show some evidences for all this. Yoga improves your psychomotor efficiency. Your eye-hand leg coordination. Your personality gets, you radiate happiness around, and all that. You look young because your wear and tear in your system gets minimized, because yoga brings all your body functions to the lower side of the normal range. Instead of heart rate being 80, which is also normal, it is brought to 60. Then heart is resting 20 times in a minute. This heart is beating 80 per minute. This heart is beating 60 per minute. So the wear and tear in this heart will be much less as compared to this. This is what yoga is. When you practice yoga, all the physiological functions are brought close to the lower side of the normal range. This also gives a greater buffer for reacting to stress. If you are already here, you are going to shoot here. But if you are here, you are going to reach only here or maximum here. This is what yoga does. So body flexibility improves. We measured it by goniometer. I'll show you some of the data. Cognitive functions, non-cognitive functions improve. Anxiety level comes down. Concentration, memory, all this improves. I'm going to show you data, so I will not. Then it is so yoga is promotive. It helps you to increase the tolerance to stress, be it environmental, emotional, or physical. It helps you to improve the tolerance. So yoga is promotive. Yoga is curative. It's a lifestyle intervention. I'm going to show some data which we did with Satish Gupta at Mount Abu on this for the heart ailments. Then the reduction in stress response, your adjunct therapy, complementary systems. So all this is possible through yoga. So yoga, there are a lot of data, including from CITER. Some of them are here. You will find in numerous literature in India, from India and abroad, that arthritis, allergy, asthma, even SBASA, Dr. H.R. Nagaratna Nagendra have published in asthma in British Medical Journal. So like that, there are many scientific evidences done on a randomized clinical trials, controlled clinical trials, which not only I have picked up a few, but there are many, many conditions in which hypertension, peptic ulcer, insomnia, and diabetes, and all this is very, very, it's well established through scientific evidences. So it is evidence-based medicine. So this is how physical, mental, and spiritual level it works. So I will not elaborate on that. And your performance improves. Say like your performance at sub-maximal level of exercise increases. We are not going to be running a marathon, or we are not going to run a race, but then you need to keep a good health. So to maintain sub-maximal level of exercise, performance improves, even at the physical level. So I'll show you some of the evidence quickly. So then another Om is recited. It doesn't have any religious connotations. It is actually a spiritual the sound. Even the whole universe has the sound of Om. That is what some of the astronomers have demonstrated. So one of the American scientists have mentioned, and just say Om, that itself have got tremendous effect, which have been proven by American scientists. Now, I will show some of our own experiments, which we did quickly in 5 minutes. Just give a chalak dikhana chahta hu. I'll just show a little bit. So we took 3 groups of soldiers. Since I was in DRDO, one group practicing physical training program of Army, another one in place of physical training, yoga substitution, and another one supplementation, yoga and physical exercise, as was mentioned by our Holiness Jagat Guru Dilip Ji. He did yoga, he also did exercise, sports, and others. So that is why there was another group which did both. So we were looking at these groups. How does these, like here, for example, I'm looking at all the neurophysiological functions like sleep and the cognitive functions, visual, the auditory evoked potential, visual evoked potential, P300, all that, respiratory functions, including the diffusion, and here the evoked potentials, physical exercise on treadmill, and also environmental chamber, high temperature, low temperature, we have put them, and also measure the physical performance on a bicycle ergometer at maximal and submaximal level. Now, just to give a little glimpse, this, I won't go into the details. What it shows, the heart rate from this is basal heart rate, comes down from by 6 beats, 6 to 8 beats within 6 months of practice of yoga. This is the control group, which remains at the same level, basal heart rate. And this is what it comes down significantly lower in this group. So even if it is 6 beats per minute, the wear and tear in the system, and also the messages, it increases the parasympathetic buildup. Similarly, your respiration becomes slow and deep. Instead of being shallow and fast, it becomes slow and deep, rhythmic. So the message is, yogic practice helps you to build parasympathetic tone, which is supported by the heart rate variability spectrum, which I won't go into the details, but everybody knows this. Similarly, alpha index of EEG goes up. So that is also a reflection of mental tranquility. It is shown here in the 6 months of practice, what it was at the initial stage, how it has reached after 6 months. And EEG, which I showed, I am just showing the actual one representative. And then when you did the functional MRI, we found there is an activation both in the occipital as well as prefrontal areas in the people who practice Raja Yoga meditation for more than 10 years. So we were looking at, that means your higher nervous functions like decision making, even extrasensory perceptions, all this is possible if you are able to do this for a long period of time, like 10 years, 15 years. It is possible. So your decision making becomes very good. How do you take decision? You get data, information, your likes, dislikes, prejudices, everything ultimately decide. What yoga does, it increases the strength of your ascending reticular activating system. So it allows only the signal which has to go in. So your signal to noise ratio. Noise is all your likes, dislikes, or disturbances. So stress, everything is disturbing your decision making. But yogic practice strengthens these filters. And so only signal is allowed to go in. So it just signal emerges. You don't have to take a decision. Decision emerges. So this is the intuitive decision making. So all this is possible when you practice yoga. It actually strengthens your decision making. Then on the body flexibility, we took the middle-aged people between 45 to 60, and we found even at that age, it improves your body flexibility in neck rotation, hip flexion extension, shoulder flexion extension. We actually measured them using the goniometer. And so yoga improves your body flexibility. It keeps you supple, which is important to remain youthful, active. Similarly, your lactic acid buildup. This is the control group where you see lactic acid shoots up. This is the control. And then during the exercise, it builds up. It builds up here. And this is the yoga. This was the initial part. Then after 6 months, when you put him on this submaximal level of work, the rate of buildup of lactic acid is reduced. Thereby, the onset of fatigue will be much delayed. Biochemical profile show a relative hypometabolic state. I won't go into the details. Then when you put in a cold chamber with only shorts on, because soldiers, it's important, they work in high altitude mountains where it's sub-zero temperatures. So it improves the cold tolerance. See, we did that by a control experiment in cold chamber. So I will just give the message, it improves the cold tolerance as well. So that is why yogis with minimal clothing, they just go around in mountains, caves, and also in snow-clad areas. So this is what is shown here. It improves the tolerance, thermal tolerance. It reduces anxiety, reduces depressant scores, and improve the concentration and alertness of your mind through vigilance score. And it is also prophylactic against diabetes, which I have shown by the glucose tolerance test, where yoga group, you see the after the glucose load, the buildup is less as compared to the pre-yoga practice level, and then ultimately comes down quicker. And hypertension, everybody claims yoga is good for hypertension. So here I showed how does yoga brings the blood pressure back to normal in hypertensives. So what I did, I took 40 essential hypertensive patients, randomly divided them into two groups. One group was control group was put on a tilt table, and the table was tilted 70-degree head up or 45-degree head down. So the patient was to only lie down on this. But in the other group, experimental group, yoga group, I selected asanas which will involve the head up and head down tilt, like you say, this Bhujangasana, Dhanurasana, Surya Namaskar. It all involves head up tilt. Then Ardha Halasana, Viprita Karmi, Sarvangasana. It's a head down tilt. So the hypothesis is the baroreflex, which is elicited from the baroreceptor in the carotid sinus, that keeps a check on your blood pressure. So unless you knock it down, you cannot establish hypertension. So this is the hypothesis. And you can reactivate the sluggish baroreflex by stretching and removing the stretch. Like when you do head down tilt, you are stretching, the whole blood pools in the the head and neck region. So stretches the baroreceptors. And then when you do head up tilt, you are just actually removing the stress. So constantly stretching and removing the stress, you are reactivating the sluggish baroreflex. Thereby the blood pressure comes down. So once the carotid sinus is, the baroreflex is reactivated, your catecholamine level comes down, the urinary catecholamines come down, and also the renin-angiotensin mechanism gets corrected. So ultimately blood pressure gets restored. So you have a unifying role of baroreflex in establishing hypertension, pathophysiology, and its recovery. And yoga can do that. So the last part is, this is with Dr. Satish Gupta. I did this work at Mount Abu with my DRDO scientists from DIPR, DIPAS, where we gave a lifestyle intervention. See, Dean Ornish put the patients, 45 patients in a hotel environment, controlled environment, gave a rigorous the exposure, and did the mindfulness and other forms of mental relaxation, including diet. But then we put them in the real home environment. We only give a orientation at Mount Abu, and Satish Gupta was actively involved, and he was the prime mover for this program at Mount Abu. From Dr. R.C. Sani from DIPAS was the prime mover from DIPAS, and then I was the coordinator for the whole program. So in this, what we gave was 3 risk factors. One is the aerobic exercise for taking care of sedentary living, walking in the half an hour in the morning, half an hour in the evening. Vegetarian diet to take care of dyslipidemia, which is very important causative factor. And the third is stress. So we managed it through Raja Yoga, then vegetarian diet, which is low fat, high fiber diet, 15 grams of fat, including hidden fat, then aerobic exercise. We gave this. So there were 524 patients randomly divided into 2 groups. One group was given conventional medical management. In the other group, conventional medical management for coronary artery disease, where at least one coronary vessel having blockade of 70% was chosen as inclusive factor. Then we found, first time, we demonstrated regression. Even Dean Ornish showed arrest of progression of the disease, but whereas our experiment showed actual regression. I'll show you some coronary angiogram. I will just skip all this for the paucity of time, lipoprotein A and plasma insulin, leptin and all that, glucose tolerance we measured, then cortisol, DHEA, and then catecholamines. Now I'll show the coronary angiogram. This is the melatonin rhythmicity we measured, which probably Satish Gupta will speak on all this, so I will skip this. Just see this control group, which showed progression of the disease. And where the blockade was 52, now it has become 72.45. But whereas in the experimental group where lifestyle intervention was given, 78% blockade become 47%. So this is, we actually demonstrated, seen by 3 cardiologists independently, blinded. So they don't know which one, which group received the intervention. So again, 88 to 41. So then we gave this hypothesis. I won't go into the detail. Then we did some experiments using yoga therapy for such kind of diseases like sinusitis and intermittent claudication. Then anxiety, all this I will skip now. I'll come to the last slide. The quality of life improves. I did some work on Sahaj Yoga for epilepsy and control and management of epilepsy. This is also very important work which we did along with Lady Harding Medical College. Now this is on the Sahaj Yoga, and these are all in publications, so you can see. The message is we need to start yoga at school level. This is what is the one message, but that is where young minds are there. The future is there. So let us start there. So it should become a part of the education system, the curriculum. It must be there in all schools so that we can create, not only in India, across the globe. Then hospitals, not only to the patients, but the caregivers, the family members who are coming there. We should expose them. We should promote yoga in hospitals for the patients and for the caregivers and the family members. And then yoga in corporates, executive stress management, which is being done in a small, modest way, but it has to become a wave. It has to become a movement. And that will give a congenial the climate. Amity Institute of Indian Systems of Medicine, Dr. Ashok Chauhan, and all of us, we promote yoga in a big way. So in this, we have started BSc Honors in Yoga, MSc Yoga. Now we are going to start PhD in Yoga. So in Amity, we have promoted this, and we have started a foundation course and wellness for wellness, the promoters. So we have started this in Amity just 3 years ago, and the first batch is going to pass out the undergraduate. Then we have established in our New York campus, we have a Long Island campus. There's this 175 acres built-in complex we have acquired from St. John's University, where we have established a Ayurveda Research Center, Amity Ayurveda Research Center in the Long Islands. And then we have established a herbal garden where a minister is inaugurating, Minister of Ayush. And so we do a lot of research in the traditional systems. So the final message, carry home message to each and every one of you, that promote, popularize yoga at global level. Let it become a movement. Let it become a wave. And just not only stop with creating awareness. Let us create a movement. And yoga centers to create awareness and preparation and circulation of ICT materials. In this International Day of Yoga, let us all contribute to this in our own modest way. And also international committee with representative from active yoga centers, which is more than 300 in India and across the globe in thousands. So let us connect, let us bring synergy, let us bring a force multiplier effect by uniting together. So this is what we should do. And also do more research like functional genomics, proteomics. How does it affect the epigenetic factors? And all this you should do research. Now go into the molecules and genes. And this is what is the founder president, who has the founder, Dr. Ashok Chauhan, who has created 11 universities in India, 17 campuses abroad, and 28 schools. We are promoting yoga in all these centers. What I want to say is he believes strongly in God, and so he is a great promoter. And his dream is India should become a knowledge superpower. When he says knowledge, just not only material knowledge, including spiritual knowledge. So that power India has got. That is the cutting edge. That is the victory for India, that we have a spiritual root which many other countries may not have. So with this, thank you very much, Dr. Ananda, for this great opportunity you gave me for this sharing, but I have taken a little longer time, 5-10 minutes more, but I'm sure that this would have been useful to the people participant. Thank you so much.
Thank you so much, sir, for that most inspiring and illuminating presentation. I have listened to you for the last close to 40 years now. For the last 40 years, I've been listening to you, and I think every time I listen to you, I get a new message. And what a beautiful message of the preventive, the promotive, and the curative aspects of yoga. I think we need to look at all the dimensions. And I thank you so much, sir, for taking time out of your very busy schedule. It is amazing how such great people again and again are so willing. I think when I sent out the invitation, one of the first responses was from sir saying, yes, Ananda, I'll be with you. That is again a sign of greatness. One is humility. Second is giving time to share with others and spread wisdom. Because wisdom cannot be in a box. It has to be spread. It is like the fragrance of the flowers. Thank you so much, sir, for your amazing fragrance of wisdom you have spread amongst all of us today. And this message will be carried to our heart and taken across the globe. Such a privilege to be with you, sir, today. And may your blessings keep us all on the path to the highest wisdom, which is the most important aspect of being human. Dhanyavadaha, sir. Thank you so much.
Thank you, Dr. Ananda. God bless you, your family, and the yoga family, all members who are present here, and all those Sarve Bhavantu Sukhina. Thank you.
Thank you, sir. We now have the wonderful opportunity to welcome someone who is always at home with us, and we are at home with you, sir. Our dearest and most inspiring Professor K.R. Sethuraman, sir. Sethuraman, sir, and it's amazing how today's program set up with Selvamurthy, sir, and Sethuraman, sir. This is just an amazing way the universe plotted it. I say the universe plotted this because, again, this message that I keep on getting, with greatness comes humility. With greatness comes a capacity to share. With greatness comes a capacity to mentor others to expand their potential and manifest it in abundance. And I think one of the most inspiring mentors I know in my life is Sethuraman, sir. He has inspired so many, all of his mentees, and these are all his children, Jnana children. They are children of his wisdom. And each and every one mentored individually to bring out their own inherent potential. Now, it is not making, clones, but it is making each individual be the best they can be. And at this time, just for the sake of the expression, I would like to read out sir's, little bit of sir's biodata, but it is, as I said earlier, it is not about the biodata of the person. It is about who the person is. And with Sethuraman, sir, always, every moment is a moment of sharing. Every moment is a moment of caring. There's never a moment where, you feel that something is missing. I think one of the greatest qualities, sir, that I have always admired is the capacity to enable everybody to feel at ease, with you. I think that is such an important quality. Sethuraman, sir, is currently the Dean and Senior Professor of Medicine and Medical Education at AIMS University, Malaysia. He served as Vice Chancellor of our own SBV and was the prime mover behind CITER and CIMTER innovations here. He had served for so many decades as Director Professor Internal Medicine at JIPMER. And again, one of those founding fathers of the National Teacher Training Center, NTTC, that has been such an amazing contribution to medical education. Amazing authorship, the books, and I love these non-medical aspects of the doctor-patient communication, post-mortem, etc., and amazing articles that really go and touch the soul of each individual. And the different videos he has made Sir never loses an opportunity to share. I think that is the greatest quality of Sethuraman sir. He will never lose an opportunity to share. And every time, without an exception, that sir has presented for CITER at SBB or in any of these meetings, there have been so many takeaway points. One of the greatest contributions is salutogenesis. Salutogenesis, that has become the buzzword of SBB, and now because of his blessing has become the buzzword of yoga therapy across the globe. We are all talking of salutogenesis and not pathogenesis in yoga therapy because of Sir's seed. Ikigai, the healing environment. What amazing teachings, and every day, every time there will be a new message. So we are looking forward to the message from today's session, sir. Before I invite you officially, I would like to request Meena to say a few words, because she has, again, been blessed to be mentored by you. Both she and I may not have directly done academic courses under you, but we have blessed with your mentorship. So I request Meena to say a few words.
Namaste all, and namaste sir. Such a wonderful talk we just listened to. So blessed to be able to hear such eminent people, our seniors, and we are gathering so many points, and it's like we are learning. And Sethuraman sir is like a father figure for us. That is the closest that I can tell, because the moment we walk into his room, there's a kind of bonding that has set up. We never tried anything, or to build a relationship. It just happened so naturally with Sethuraman sir. It has always been like that, as if we are part of the family. So sir has always been the father figure for us. And CITER, whenever we think of anything at CITER, there is always an input from sir. So anything and everything that CITER is today, the sir and AK sir, both of them play a very important role in shaping up CITER and giving it whatever it is today. We owe it to Sethuraman sir and AK sir. So thank you, sir, for all that you have been, and for making us, for that rapport that we have, you have created, for making us so free with you. We don't have to have any inhibition with you. So thank you so much for all that you have been for us.
Thank you. Namaste, Meena. You are a midnight cowboy from USA. Okay. So can I start, Dr. Ananda?
Yes, sir, you are most
Let
welcome.
me share the screen then.
Yes, sir. Yes.
I hope it is visible.
Yes, sir. Perfectly, sir.
Yeah. Okay. I have to record my thanks to the previous home, Balaji Vidyapeeth, and the senior management. And of course, a special thanks to CITER team and under the care of paternal care of Bala Yogi and maternal supervision of Dr. Meena. So that is how it runs. And I'm speaking from this garden campus, my 10th year as dean, medical dean, third year in my second innings here. It was broken in between by 5 years at Balaji Vidyapeeth. But what is amazing is the aerial view. When you fly over our campus, this is what you see. And our founding father, Dato Swami Velu, he wanted a chakra design. That's why I'm showing this. It will make a lot of sense to yogis here who are trained in yoga and ancient Hindu wisdom. He wanted a outer ring road, or exact diameter 1 mile. If you start from here and walk one round, it will be 1.64 kilometers or 1 mile. And then the library is the axis of the wheel, so it is a central part. And then engineering block, and now the engineering and dental and allied health is there, and medical block and pharmacy. So that is the spokes. And then this is the admin building, and this is the student center. These are the hostels. So the whole thing is designed in the chakra format. And this is the 9-story apartment block. Of course, Balayogi and Meena were here for a few days. And this is the bungalow where I am safely doing Karma Yoga for the past 15 months now, staying alone and staying safe. That is more important, I think, these times. So just wanted to share this campus. Hopefully, when things return to normal, many of you will be able to visit us once more physically. So I'll start with 2 quotations to set the tone. Mine is because I am not a yoga therapist. The only yoga I know, as certified by Balayogi, is Karma Yoga. I don't know any other yoga. The only asana I know is Shavasana. You let me do Shavasana now and sleep off in the middle of my talk also. There is no problem about that. So, where is the life we have lost in living? Where is the wisdom we have lost in knowledge? Where is the knowledge we have lost in information? So that is a plight of modern progress of humanity, that we do piecemeal research, piecemeal identity, and then so much of information is gathered. And all that clouds the knowledge, and whatever knowledge, excess knowledge created, especially with infodemics and social media and all that, and the wisdom gets clouded. So that is told by Eliot many decades ago, before all this internet and things came about. And so that is plea for wisdom and enlightenment. At the same time, I want to quote Carl Sagan, that of course he is borrowed it from other scientists who have told the same thing in different words before him. But Carl Sagan is a scientist, well-reputed scientist, and this is necessary. Pays to keep an open mind, but not so open that your brain falls out. No? Very nice way of saying, please maintain balance between exploring innovations with an open mind, but at the same time have healthy scientific skepticism and a robust way of confirming whatever you see is real and not a false claim. So that is a tool yin and yang of my talk, and it will be from the perspective of a physician who uses complementary and alternative medicine in an integrative fashion. I've been doing it for 35 years now. So basically my talk, I wanted to carefully plan to avoid overlap, because Balananda has got top speakers on 14 or 15 different topics. My problem was not to overlap on others. So I'm going to talk on curing versus healing, the first part, and then cover the Wickenburg 1988 consensus report, which is not known to most of us. 4 factors of healing. This is the American Kaiser Foundation dialogue that happened 33 years ago. Then optimal healing environment. So postmodern global initiative that is taking place right now. And I want to say how yoga therapy, this is all my surmise, how yoga therapy could adopt optimal healing environment concepts in yoga practice. I've seen it in action in Saiter, so I think my surmises will be agreed upon by Dr. Meena and Dr. Anand. Then lastly, sense of coherence approach, which is actually integral part of salutogenesis, which promotes wellness, and how yoga therapists can adopt or are adopting salutogenic mentorship approach. So I start with my stories first, because for me it is post lunch time. I have to keep awake more than you keeping awake. So this happened in early 80s or mid 80s. I can't recollect. About 35, 38 years ago, I was treating a guru, one of the gurus in Pondicherry, and once we used to discuss a lot about spirituality and things like that. Once he said about healing, he said, "Do you know the difference between healing and curing, doctor?" Then this is the exact replica. Since it's all being recorded, I put it verbatim almost. So he just said, sir, supposing as you are treating me here and examining me, somebody steals your car and goes off, then what happens? You don't know. When you go for lunch and search in the car park, car is missing. Then you get panicky, tell the police and other things. And since your car is new one with GPS or whatever, they detect it quickly and return it. So as far as the police is concerned, they have solved your case totally because car was returned intact to you. So for them, it is curative operation, case closed. But are you back to the normal next day, tomorrow when you come taking rounds or seeing patients in outpatient or whatever you're doing? Is your mind totally in that, or half the time you are worried if somebody is going to steal your car again? So that means you are not the Dr. Sethuraman of today. Now, before the car stealing, even though the case is closed by police, you are something different for a few days at least, or a few months, or a few years, until you get back to your normalcy and stop worrying about the car being stolen. So therefore, your problem is cured, but you are not healed. You are totally healed only when you become what you are today. So that struck chord in my thing, and that was my one of the epiphany moment, that is eureka moment. Eureka moments of my life, there are a few, this is one of them, where I discovered the difference between curing and healing. So this story I must be telling, I think Ananda must have heard it at least 10 times till now. But every batch of students, I repeat the story because I can't find an easier way of explaining the difference between curing and healing. Then soon after that episode with Guru, there is a proof, a teaching case, school principal with asthma. I gave the optimum treatment and advice and everything, but this is how he was. What is the point in living like this? I am a principal of a large school with more than 1,000 students, but I can't even breathe. Like the peon who comes, runs around in my school. You claim my lung function is okay on medicines. Your PFT is normal, etc. But I don't feel so. And he was like this. The bent and body language is all negative. So I realized that lung function normalcy is not the same as healing. So I'm not a healer. I have no idea about yoga or yoga therapy. So Dr. Madan Mohan was with us, professor of physiology. So he was one of the first cases I referred to him. And he said, I don't need a place to treat him. I had a respiratory clinic twice a week, I think. So I put 2 mats there and said, okay, here is your space, come and do magic on this person. So within 3 months, Dr. Madan Mohan could convert him, and all the negative body language disappeared. He still had asthma, he still had to take all the medicines, but he was a changed man. He was smiling, he was confident, he was vertical, erect, looking forward and positive about life. So therefore, though I could control his asthma, the healing was done by Professor Madan Mohan. And the tool he used, instrument he used was yoga therapy. So that is the first epiphany moment and the story supporting that. The second one, epiphany, happened in WHO workshop, 2-week workshop in Thailand, Pattaya Beach, Medicine and Society. Such a serious topic on such a frivolous joint. Anyway, life is full of contradictions. So 1990, we spent 2 weeks there. And effective therapies. This statement was made by Elizabeth Sachs, a lady medical anthropologist, and Joran Thompson. He had visited the Pondicherry twice. So both are from Karolinska Institute that awards the Nobel Prize. So they gave a simple formula. Therapy is equal to intervention, whatever we do, chemical, surgery, yoga therapy, music therapy, whatever, plus information, plus faith. So only if these 3 add up, you get effective therapy. So that was on the basis of their study in Sri Lanka and Sweden, primary health centers. This Thompson wore cap of rationality and see whether they are practicing rational evidence-based medicine. Whereas Elizabeth Sachs was seeing through the lens of medical anthropology, whether the doctor-patient interaction is anthropologically sound or unsound. It was very interesting. Uh, Thompson said in Sri Lanka, where he did the study, 80% was irrational remedies and only 20% was evidence-based. And reverse, 90% evidence-based in Sweden and 10% irrational in Sweden. So he was appreciative of that. But Elizabeth Sachs, who came after that with the anthropological look, she said Sri Lankan patients are highly satisfied, 90% patient satisfaction in Sri Lanka, only 10% were dissatisfied. Whereas in Sweden, it was reverse. Hardly 1 in 10 were satisfied. 9 out of 10, nearly 9 out of 10 were dissatisfied because these doctors never looked at the patient, they never examined, never touched them. They saw the computer screen, laboratory reports, and said, you don't need any medicine, and chased them out. So they were unhappy. So she said, anthropologically, whatever Swedish doctors did is irrational, and whatever was going in South Asia is rational. So that was epiphany moment for me. Okay, we are just looking at textbook of pharmacy and the pharmacology and all that and talking, but healing and therapy is totally different and made a lot of sense. Therapy is equal to intervention that we do, which can be evidence-based, hard, very scientific, but information that is understandable to patient and faith that they believe in whatever we offer them and they take it with this thing. So my surmise, yoga therapy perhaps combines the art and science of mind-body medicine to offer effective therapy. In the intervention, you just put yogic practices or yoga therapy advice, and then it becomes therapy is yoga plus information plus faith. Okay. So in the same workshop, this Wickenburg Consensus 1988 was funded by Kaiser Foundation. And one of the people who attended that was a 4 or 5 day workshop where they assembled, I think, 38 top scientists, physicians, and all these people. And then they identified the healing factors. Maybe 38 is a small number, maybe 64. So finally, they came with this thing with available evidence. What we say is rational scientific treatment, now which we learned for 4.5 years in MBBS and various other periods in different courses, only constitutes 20% of the healing. We are not talking about the treating part, healing part. And the remaining 80% is faith-based. The major chunk, more than nearly 1/3, a little more than 1/3 is placebo effect, which is well known to modern medicine trained people also. Then Hawthorne effect, faith in the system. Not many people know that. That is almost 30%. The remaining 15% is a spiritual factor, faith in oneself or faith in supernatural. So this was the summary. And this, since it is not well known, I have a photocopy of this Wickenburg Consensus book. So based on that, actually, I compared the new MBBS curriculum, how it aligns with Wickenburg Consensus recommendations. That report is available if you are interested in following this lead. So then we go on to placebo and the 4 factors, 3 factors. First is placebo, and that is I shall please. That is the meaning in Latin. And opposite is nocebo. It's like yin and yang, opposite. Nocebo is I shall harm in Latin. So any effect attributable to a medication or a procedure not based on its pharmacological or specific properties comes under this. Can you quantify placebo? Of course you can. And across generations of people, it is more or less stable. In Professor Beecher estimated in Harvard University in 1955, the studies are available if you are interested. 15% to 58% is the placebo response, mean of 35. That's what they used in Wickenburg Consensus. But after that, in 1986, professor from Yale University, Spiro, had estimated in duodenal ulcer, placebo response was up to 70%, and he got a mean of 50%. With this H2 blocking drugs and proton pump inhibitor and all that, he did a placebo control and very high. So in fact, if you're interested, there is a huge 20-page article on New Yorker. This is also downloadable. Power of Nothing. That is the title of the article. Please read that. Okay, if you want laboratory proof, just as my predecessor, Professor showed, this is a PET scan proof of placebo response, published in Science in 2001. Expectation and dopamine release. Normal PET scan of basal ganglia for comparison. This is a Parkinson patient before and after administering a placebo. The dopamine is released in basal ganglia almost to the normal amount compared to his pre-placebo amount. So therefore, there are ways of studying through fMRI, functional MRI, or positron emission tomography, PET scan. It is possible to estimate. If you are interested in cutting edge research into this, you can do it. So Harvard professor, Kupchak, he says, it's time that power of placebo be examined, and then if you ignore it, medicine will always have a limited perspective or perception of healing. This is a 1998 paper, and he has given a nice, inspiring TED talk, which you can probably show your students. So what are the postmodern voices? There are three. I have many that I am showing. One is Ernst, 2007, that patients can benefit if physicians maximize the potential of placebo effect along with evidence-based effective therapy. So a successful doctor-patient relationship itself fosters a strong placebo response while mitigating nocebo response. So this actually comes under the next factor which I am going to talk, this relationship induced. Third is my own. In clinical trials, randomized clinical trial, placebo is an unwanted interference. But in clinical practice, when we are treating patients, placebo is not an unwanted interference, it is our armamentarium. But nocebo is an unwanted interference. This I keep telling all the students that I meet or I teach or attend when I start orientation programs for them. Okay, now passing on to the second faith-based factor, Hawthorne effect. Caring as a beneficial force. When employees perceived that employer cared, productivity always improved. This is a very old study. It's going to be 100 years soon. 1927 to 37. They did this study in Western Electric Company's plant in Hawthorne. That's why it is called as Hawthorne effect. And later we found that it works in the healthcare scenario also, because patients feel better once they decide to put themselves under care of physician, nurse, or a hospital. Yesterday, my Palakkad youngest sister's family, except them elders, all the rest, 6 of them have got sick with corona. They are all miserable at home, but the minute they entered the hospital, they say, we feel fine. They are happy. They are all in general ward only, nothing to worry about. But this, I have had a personal example of this Hawthorne effect yesterday from India. So it matters, according to Dr. Kerwhite, whose book is available and his paper is also available, 1996, said even it need not be doctors and nurses, even administrators, attitude of management and supervisors of Balaji Vidyapith and Mahatma Gandhi Medical College influence the length of hospital stay in Mahatma Gandhi Hospital. So this has to be informed to them so that they also are supportive of patients. So then you can have a quicker turnover. But of course, if you want a bed occupancy and want them to stay longer, it has to be the other way around. So just making some jokes. Okay, unfortunately, the healthcare providers and managers are either ignorant or ignore these seminal ideas, says Kerwhite. And the third factor, spiritual factor, of course, yoga therapists know a lot about that. So I'm not going to talk much on that, other than saying in 1984, that was the year when WHO added spiritual dimension in health. And this is a universal symbol of all religions and all beliefs in one logo. That's why I put it up there. Doesn't matter what is your faith. As long as you have a faith, it works. So that was the basis of this WHO study on quality of life, spirituality, religion, and personal belief, SRPB. So they studied more than 5,000 people in 18 countries. And they found this. Women have greater feelings of spiritual connection than men. Of course, it is understandable. And less educated people report greater faith. That is also understandable. The most educated people are most confused in this regarding spirituality. So WHO says we need to assess our patients' SRPB. And they've released a test instrument which we can use if you want to do research in this field. American Association of Medical Colleges, 1999, endorsed this. And they said, eclectic view, it's not a particular god or anything. Search for ultimate meaning in life through participation in religion or belief in God, family, naturalism, rationalism, humanism, belief in oneself, or belief in any art form. So these factors influence how patients and providers perceive health and illness and how they interact with each other. So that is what they said. And they said it's a dimension healthcare providers must be aware of. But at the same time, postmodern view is quite balanced, like Carl Sagan's quote, we can't let the brain fall out of our skull. Prayer is not a substitute for rational medical treatment. It is an important element in the way patients cope with chronic illness, suffering, and loss. So we need to address and be attentive to all suffering of patients, whether it is physical, emotional, or spiritual. And when I cannot help in emotional or spiritual field, then I take help of counselor for emotion and yoga therapist for spiritual domain. Because doing so is a part of delivery of compassionate care. So these are two authors who said that in 21st century, postmodern times. But postmodern time also sees more and more specialization and piecemeal specialty care, which goes farther and farther away from holistic practices. So this is a letter, dear doctor. Now this book is very passionate plea for holistic approach to healthcare, written by Charles Odegaard. Personal, dear doctor, a personal letter to physician. I think it's available on Amazon. So holistic healing we should also discuss like medical sociology, medical anthropology, complementary alternative medicines like Ayush in India. They should adopt. Instead of having a tunnel vision, unfortunately, my feeling is you go for keyhole surgery, it becomes more tubular vision. Because the 24 hours you are only thinking of keyhole and practicing keyhole surgery. And if you adopt Da Vinci as your aid, a robotic aid for surgery, you get farther and farther removed physically from the patient. You can sit 2 cities away and operate on a patient in some other operating room. So that is a tragedy of specialty care now, that we are losing touch on holistic approach. So professor of family medicine in Washington School of Medicine, Agnew says to heal is to acquire wholeness as a person. That's what Guruji told me in early 80s. Acquiring wholeness means all our domains are intact and back to normal, or fully working at least, even if it is not normal. So wholeness involves physical, emotional, intellectual, social, and spiritual dimensions of human experience. That was definition given by him. It's a very nice article, meaning of healing, from my kind of physician's perspective, that viewpoint. So it appeals a lot to me. So this is available. Types of healing. In his article, and others have, like Miller have said, spontaneous natural healing, naturopathy. Body tends to heal by itself. Nature is great. Technological healing, that is where we come in, whether you do keyhole surgery or Da Vinci surgery or any other intervention based on evidence-based rational medication and procedures that we do. And the third one is interpersonal healing due to faith, the placebo, hawthorn, and spirit. So this is in a perspective biology and medicine. It's the best or most favorite book journal where you can get all this mind opening new ideas. This was recommended by my guru, Professor Chandrasekhar. So I read it now every 3 months. I make it a point to read this. Okay, so but when we talk about all this, we are trained on evidence-based rational medicine for let's say 10 years if you are MD and 13 years if you are a DM or MCH. So this holistic care is anathema, and then this is the question I commonly get. If I use non-rational means for faith-based means for healing, will I be just like another snake oil salesman, so-called charlatans who claim so many things without any scientific basis? What is the difference? So question is, can we ethically promote innate healing responses? That is a question they ask. And it's a very valid question. I spent a few hours searching the net until I got 8 ethically valid ways of promoting innate healing response. This is what I show my junior doctors in the making, interns and final year students. Speak positively about treatment. Don't scare them about the treatment. No, balance both risk and benefit, cost and benefit must be balanced. Provide encouragement. Take personal interest in the patient recovery, like that music. People do. Develop trust and rapport. Provide reassurance. We'll do our best. The outcome is left to your body and to other forces. If they believe in God, then of course it is God. Then support relationship, doctor-patient relationship, nurse-provider-client relationship. Then respect individuality. He is not another case of corona. He is a unique, Murugan, a 78-year-old man who is a believer in Palani Andavar, who has come to you with early corona, and then you have to take care of him. So if he believes in the Lord of Palani, then why don't you engage his help also to make him recover faster? So explore values and create ceremony. Create ceremony means, I'll give an example. This I use a lot. I used to do it in Jipmer. Find out these other things, especially in patients when they go home. These chronic diseases, my problem is diabetes, asthma, hypertension, most of the things I treat is chronic. So much so I have patients I've followed up for 40 years, 45 years and all. Even now I'm treating some by telemedicine. So create ceremony means, if they believe in God, I'll say every morning when you take bath, do you pray God? Yes. So when you light your lamp and put a holy ash on your forehead, in addition to the pinch of holy ash that goes into the mouth, keep your tablets also and pray to God. God, these chemicals must help me recover better, and swallow it. So every day that ceremony. So I achieve 2 things. One is take the power of placebo, hawthorn and spirituality in one go. I get 80% more effect on the drug. And secondly, because he does every day, he doesn't forget to take the medicine. That dropout rate or non-compliance rate is very low. 99% of the time or 100% they manage to eat, take the medicines. So therefore, that is my way of creating ceremony. It is a creative art. Each one is free to find a ceremony that is acceptable to the individual patient. Okay, so that is the first part. The second part is much less, only about 10 slides on optimal healing environment. How do you create that? If you have the money and corporates kind of setup, you can make beautiful wards like this. So patients will come and they probably won't want to go home. So this is a bed and this is the natural surrounding. So, in fact, optimal healing environment is a postmodern concept. There are journals on architecture devoted to optimal healing environment, journals on interior design, journals on exterior landscaping, all talking about OHE. Only in medicine we hardly ever talk about OHE. So I thought we should also join the bandwagon. So it is time that all the hospitals and healthcare providers move from curing to optimal healing. So, because both are essential, healing and cure are complementary and both are needed. And one can heal even when recovery and cure are not possible. I have seen healed cases, who are blind. Healed means functionally whole. They don't feel that they lack anything. So, one can heal even when recovery and cure are not possible, and adopt healing-oriented approach to create OHG. So that is a postmodern trend, as I said before. And we'll see the four elements that constitute, four domains are elements that constitute OHG or optimal healing environment. Internal factor. The patient must want to heal well. If they don't want to heal well, then how can you treat them? No? I had a daughter-in-law who's was slave-driven, like Cinderella, working all the time. The only time she got free was when she threw a hysterical fit and got admitted in my ward. So, so her intention was not to heal. No, that was her escape route. So sometimes you get odd cases like that. So, that's a teaching case again. So people want to get well. So unless the mother-in-law changes her attitude, the daughter-in-law will not get healing intention. So therefore, we have to go in depth and find out what is wrong and then try to solve it. So in that case, I had a long counseling session, not with the mother-in-law, but others in the family. And then the father-in-law gently convinced the wife not to be so intolerant of slave driver, her like Cinderella, and then slowly it subsided. Interpersonal, behavioral, external. So we'll see a little detail on each and how yoga therapy can adopt all this. I've seen it in Sighter, so I can share it with you. I was watching them for 5 years, 5 months before I came here. Making healing as important as curing. That was a motto of the music therapy and yoga therapy centers in Balaji Vidyapeeth. So internal factors, as I said, expectation, hope, understanding, and belief, basis of healing intention, and personal wholeness in mind, body, spirit, and energy. So yoga, of course, uses meditation and mindfulness for the A, and wholeness approach for B, mind, body, spirit, and energy. Meditation, serenity, satisfaction in life, contentment, sense of worth, hope, self-confidence. That is how the asthma principal who had asthma got well, because Dr. Madan Mohan could give him self-worth and self-confidence. Okay, OHG2, interpersonal factors. Cultivating healing relationship with A through communication, compassion, empathy, social support, and healing organization. And how yoga therapy can use therapeutic relationship for wellness and promote holistic healing through all the faith-based practice. So now here in interpersonal space, we get an opportunity to use sense of coherence approach to wellness, because that is best linked with interpersonal. So I'll show 3 slides on this. Then we go back to the third domain of OHG. So I'm sure in this 10 days, so many people will talk about it. So I'm not going to talk about Antonovsky and how he discovered salutogenesis and all that. I discovered it in 2014. It came at a appropriate time, early 2014, when we had to push Sighter and Sumter to newer frontiers and gain footage as innovative university, because we were deemed university under innovative category. So I had to show that some Sighter, Sumter really meant something solid. Okay, so this sense of coherence came handy. And what did he say? For wellness, you have to comprehend, you have to find managing ability, and you have to find the managing methods meaningful. Then you feel well, regardless of any challenges. If you can comprehend your challenge, you find coping strategy, and you find it meaningful to adopt those coping strategy, you feel well, whether it is terminal cancer, whether it is financial trouble or anything. So my surmise, again my surmise, because I have not, other than seeing them, I have not really done any study personally, unlike Professor Selvamurthy. So yoga therapy is a general resistance resource for all the patients whom we send to them for help. And in addition, they provide specific resistance resource for mind-body medicine, cases where mind-body medicine makes a big difference. I'll show it as a mathematical formula, easy to understand. Sense of coherence, SOC, is equal to U plus M plus F. That is, understand, find, manage, and find meaning in managing. So, or I can show it in the graph form for those who are graphic oriented. Sense of coherence, my world is understandable, cognition. My world is manageable, behavior. My world has a meaning, affect. So, if these three can be aligned well for an individual case, then they do well. So, in fact, when Antonovsky said this, many people laughed it off. He said it in 1968. It took 30 years for it to gain acceptance, because at that time, in 40 nations, 70 studies were done. All of them supported in different fields of endeavor. There is a huge book which you can download on ResearchGate on salutogenesis, various chapters. I was asked to write a chapter, but I didn't have time. So, okay, so this is the graphic form of that. Stressor, any stressor causes tension. And if you do not, if you lack sense of coherence and general resistance resource or specific resistance resource, goes to pathogenesis, breakdown in parts of body, and illness or pathogenesis. So it goes this way. But when the tension is managed with the general resistance resource and the specific resistance resource, this is evidence-based therapy, this is general health, then they feel well and they recover. So that is called salutogenesis. So stressor can end up as pathogenesis in the negative side, H negative, health negative, or stressor can also push you to salutogenesis, health positive. This is also given in the old quote, no, what doesn't kill you makes you stronger. That's what it means. If you have all this GRR and SRR to help you, you feel well, you are actually stronger than before. But if you lack it, then you end up in H minus. Okay, now back to the third domain of OHE, optimal healing environment, behavioral factors, practice healthy lifestyle, bread and butter of yoga therapy, and applying collaborative medicine. That is a bread and butter of Saiter. So, promotion of Sattvic lifestyle, which was highlighted in the previous talk, and it integrates well with Western medicine, as exemplified by Saiter, working in a tertiary care medical institution. So how it impacts behavior, I don't have to tell you. It creates yoga therapy, creates joy, vitality, serenity, happiness, etc. And this is the basis of wellness. And we know that 40% of illnesses that comes to primary care have no pathological basis. All tests are normal. So they are all mind-body cases. Mind-body medicine is otherwise known as medically unexplained symptoms. And yoga therapy can be quite beneficial. Then the other way behavior changes is self-rumination. So instead of reading that, we'll see the diagram. Self-rumination and a part of meditation and mindfulness causes subjective vitality and promotes wellness. It's a hypothesized model of self-rumination, vitality, and wellness. Then the fourth domain in creating optimal healing, the external factor. This is where architects, interior designer, exterior designer, all of them come. Building healing spaces, color and light, art and architecture, aroma, air, music and sound, all of them matter. Aromatherapy. Fostering ecological sustainability, eco-friendly, green, energy efficient, and with nature. So yeah, yoga of course can easily blend with nature and has symbiosis with nature by its nature. Okay, so wellness in yoga therapy can be achieved through transcendence and mental mastery. That is a goal of all these mind exercises in yoga. Feeling of oneness with surroundings, intense happiness, ecstasy, bliss, mental mastery that results in low level of anxiety. This was lots of data was shown by Professor Selvamurthy earlier, so I won't spend time on that. But basically, I want to point out that whatever happens here, it aligns well with or corresponds to Maslow's hierarchy, goes beyond self-actualization to self-transcendence. You become even better than what you were before. That is what it means. So to sum up, salutogenesis, this article is the basis of my summing up, defining a concept for new millennium, a new healthcare system in the postmodern era. Salutogenesis is healing in all dimensions and promotes sense of coherence. And in addition to evidence-based therapy, create optimal healing environment for which yoga therapy as a complementary process will be of great assistance. I've seen it before in 2014. I said it was our brain. We have to do this thing of pushing up yoga therapy, music therapy. In 2013, when I took over as VC, I found both huddled as in a part of blood bank. One small, tiny space was given to Yogacharya to sit there and offer some yogic service as a patient care service. And the opposite room was music therapy, where the lady in physiology was sitting, Dr. Bharati. So I said, no, this won't do. And then Dr. Ananthakrishnan was the engine to push it forward. So I gave ideas, and then he really took it to heart and amplified it tenfold and pushed it to create two magnificent centers of excellence, music therapy, yoga therapy centers. And that gave global recognition to SBV. I told even chairman at that time in 2014, you push up the Sumter Citer, we will get on global map faster than any other thing. And they both proved it right. Okay, so what do I see looking into the future? I already showed the PET scan. Advances in imaging and genomics will provide insight into body's own natural healing capacity. We will unravel the secrets of placebo effect and also the other healing effects with the help of PET scan and functional MRI, etc., Hawthorne effect and spiritual factor. Then we could offer evidence-based healing therapy, incorporating these endogenous healthcare forces that unify the art and science of healing. So you give evidence-based treatment, which includes these also, bring under an ambit of rational treatment. So before I end, I just want to spend, I didn't get a picture that is worth 1,000 words in yoga therapy, but I got it from music therapy, which is the sibling of Sumter. This patient was aware of his impending demise, terminal cancer of the stomach, and they had said maybe a week or two to live. That's what they had said, and he was in the palliative care ward taking some painkillers. So this is a music therapist. She was doing MSc, I think. So she came and talked to him and tried to make a rapport. Initially, he was very reluctant. Then she asked, okay, what is the best song that you enjoy in your life? I'll learn it for you. Then he gave an old song. Probably her mother also wouldn't have been born at that time. But she went to YouTube and then learned that song. And then it was from MGR movie, Ado and the Paravai. So she sang that. And then on the third day when she sang, this fellow also joined in. He brought a clicker and both of them clicked and sang the thing. You see the boy, that man, clicking away and singing along. Big smile. So I showed this picture to surgeons and all the doctors in Mahatma Gandhi on one of the meetings, I remember, 2014. We are all great professors with DM, MCH, PhD, all that. But you give a terminal cancer patient who knows he is going to pop off in a few days. Can you make him smile? You cannot. So why don't you do your treatment and let these people make them smile? What is the harm in allowing them? So after that, they got access to operating room, cath lab, where vaccination center, and all sorts of places. So that is one of the positives in Balaji Vidyapith. It's an inclusive center where alternative and complementary systems have access to all the spaces in a hospital, which even most of the Western centers do not have. Whenever they come to Balaji, they'll say we are fringe people, we are not mainstream. But here in Balaji Vidyapith, music therapy, yoga therapy are mainstream. And this picture actually convinced many of the people who were there in 2014-15. Finally, he thanked the end of the song, he thanks and says, please come tomorrow. He listened to the song 3 more days and then he died. So that is the story. Succumbed to terminal cancer. So 2 questions for us to introspect. I want to close with the introspecting. I hope that some doctors are listening to this. With all the powerful remedies that we have in our armamentarium, so-called evidence-based rational treatment, can we make a terminally ill patient feel alive and smile like the music therapist did? If we cannot do it, why not get the therapists who can do so? Just take them along with, integrate with them. We do our bit and they do their bit. So let all the healing forces work together to help the suffering humanity. It may be mental, spiritual, emotional, or physical means. The idea is to give a good life till the life exists. And let innovative academic centers like Sri Balaji Vidyapith accelerate this process of harmonization of healing forces and adoption of salutogenic pathway for wellness in modern healthcare. Our goal for the future, to produce enlightened medical professionals who can integrate healing arts with evidence-based rational therapy. Thanks a lot. Thanks, Dr. Balaji. Thanks, Balaji and Balayogi.
So I'm lost for words, and that doesn't happen too much. Again, what straight to the heart missile you have sent of optimal healing environment and the need for humanistic model of medicine. I think that humanistic model of medicine is just such an important component, and anybody who's been a student of yours, they have 100% learned the humanistic angle of medicine from you, sir, because I think that is just so important. And throughout this presentation, what was the constant refrain was, be humane physician, be a humane therapist, connect with the person, see what is important for them. How can you make them feel alive till the last breath? What an amazing, thought-provoking presentation, sir, as always. And if you don't mind, for a few minutes, I would like to have a few questions come in. There is one from the participants, K. Narayana, who has asked, who has said, sir, beautiful info. Even I practice CAM in my practice. So I believe it's a medical practitioner. My only question is, do we have RCTs done on the healing systems? That was a question that came in. So I just thought maybe you would like to say a few words.
Randomized control trial which have been published in Cochrane Review, there are on music therapy. I think 3 or 4. 4 have entered music therapy till now. Yoga therapy, I'm awaiting. I'm trying to push Saiter to do randomized control study, but you are too much into traditional mindset. You need young blood who's like me. Carl Sagan is my guru, and then wear that hat and look at things in a
Absolutely.
randomized, controlled manner. Then you will get into Cochrane review.
In fact, more and more studies from CITES are now appearing in such reviews. So it's quite interesting that, in fact, every day now I get pop-ups telling me that CITES papers have been quoted in, meta-analysis. So we are starting to find such a lot of meta-analysis coming up. So that is wonderful. I would like to give an opportunity for Sangeeta, who is with us from Italy. She is both a yoga teacher, Yogacharani, as well as a music therapist. So maybe you would like to ask Sir a few questions.
Namaste. It's such an honor and a humbling privilege to be part of this distinguished group of speakers. Yes, sir. I wanted to ask a question about the difference between using songs and using pure sound. And this is often a question that is asked, whether there's a difference between working with memory and specific songs that are, therefore culturally specific, or if you have come across studies of the use of pure tones, the use of pure sounds, and their effect. I don't know if you have come across them, and if you can speak to this a bit. Thank you, sir.
My linkage with Saiter and Sumter was only from solitogenesis angle. As I told you, they were struggling with pathogenesis, fighting because the people say appendicitis, I have to operate. You sing 2 songs in Karahara Priya, will it disappear? And that kind of thing, dismissive. So until salitogenesis was brought in, then they gave them a broad highway to travel forward. And along with the people who took care of the pathogenesis part. So that is my only angle. Regarding sound and pure music, I've heard, had several interactions with Dr. Sumati Sundar, who was in music therapy earlier. She used to say that they have done, she has published some papers where they have done pure sound and also non-classical music and classical music, and found that classical music has the maximum effect. And this study is also replicated in several Western countries where they follow classical Western music, which is a different format than our Indian Carnatic or Hindustani music. So that is what she has told me. I hope I am right. Otherwise, I have to check with her only.
Absolutely, sir. In fact, Sangeeta's doctoral work was on Italian folk music for healing. I believe it was scorpion sting.
Spiders, sir. Tarantulas, from which the music tarantella comes from, which is, but I'm also very interested in when it comes to, the environmental salutogenesis and how integrating sound into the architecture is something that we could also integrate into this model. So it's the sight and the scent, as well as perhaps including sounds that can, there's a term called entrainment, which means that when you hear a sound like a tone, or perhaps the repetition of certain sacred sounds like the Pranava Om, for example, in certain contexts, it can entrain the sound of the machinery, or even more intensely, the sound of the worry of one's internal voices. And so that's something that I'm really passionate about in integrating into the, a holistic environment, let's say, the introduction of sound in a very gentle way, not overbearing, of course, So thank you so much for bringing it up. Thank you, sir.
Thank you so much.
I hope you didn't mind me suddenly bringing in your sibling also into the picture.
We are all birds of the same feather, flock together. We fly together. So either we fly or we sing together. So we decide to fly together.
Good. Keep it
I
up.
would like to request Dr. Rama Reddy to, ask a question or so. Dr. Rama Reddy is one of the BC Roy awardees, and he is, with his interest in yoga therapy, is currently undergoing his PhD with the CITER of SBV. So we are very happy that we have Sir. He is the best student we have in our PhD research scholars. So I introduce
Namaste,
this.
sir.
Namaste.
And you will have to answer his
Both
queries.
the lectures, sir. I do not have any question at all. Overwhelmed with your scholarship, and I am very fortunate to be associated with Sri Balaji Vidyapith. I made a talent search before entering into yoga therapy, and I found that this is the best place for my PhD. I am 67-year-old. At this age, I am a retired professor of psychiatry, and I went to a Vamana who is 18 years younger to me, and later I found that he is Trivikrama, not Vamana, Trivikrama, and such is a genius under whom I am working for my PhD. It is on chronic schizophrenia. I found the lacunae in the modern medicine. As you say, it is not just treating. I was thinking of only curing, and now you have expanded my horizons to healing level. I think we are striving for that one with adding yoga therapy. Thank you very much.
Thank you so much, sir. And I would like to introduce Shailaja Menon, who's not too far away from you. She's in Malaysia and a very eminent yoga personality of Malaysia. So Shailaja, if you would like to say a few words, you need to unmute. Yes, now you're fine.
Namaste, sir. It was a great honor. I've heard your name so many times from Dr. Ananda and Dr. Meena as well. So it's a great privilege that I have this honor of listening to you today, and very happy to know that you are somewhere near my vicinity. So I really hope to be able to meet with you sometime in not so distant future. The wonderful presentation and wonderful this whole aspect of healing versus curing. And I really hope that we move towards that in the not too distant future.
Dr. Shailaja, welcome. We are in Ames University in Sungapatani town in a remote village called Semaling. So, but maybe when the travel restrictions are removed, we'll meet up.
Yes, we're all under lockdown still here.
Yeah.
Wonderful to meet you, sir. And thank you so much, Dr. Ananda.
So I do hope that this will start a new interaction, intra-Malaysian interaction that can also come up. And I would like to ask Dr. Meena to, a final few words. I think there's also one more question, but I'll come back to that. Yes, Meena.
Do you want me to read out that question, sir?
Maybe you could read it out. And
yeah, one is from Tamarai Selvi of Hosur. Respected sir, what is your view on yoga and counseling integrated towards stress management?
This is best answered by one of you, Dr. Meena or Dr. Ananda. You are only doing it daily,
So she wants it from you, sir.
No, but I can only say that I found Dr. Ananda and Dr. Meena and her team. Now Dayanidhi has also joined, very successful in this. But if they ask the evidence, I don't have the statistics and stuff that which you have.
Absolutely.
It is best answered by CITER team.
Definitely, I think this integrative approach is the future. And as Seduraman sir has stressed today, it is very important that we all work together. I think we have to shift from this me or you to me and you and make it us. So there has to be a shift in, it's not, traditional systems or modern system. It is traditional and modern coming together in what is the optimal system. So the optimal system of healing is what we try to work towards. And Seduraman sir has been the biggest inspiration right from the days in JIPMA and continuing then into SPV and giving us an opportunity to come and also share at AIMS a few years ago. So I hope that this will be taken forward by others, because we keep on stressing on the fact that CITER is a good role model that can be adopted in other health sciences universities. So we have a working model. We have shown that yes, it can happen. So as long as the management is supportive, as long as the people at the top are supportive, then, and of course you have to have good people in the team who can bridge. You need to bridge human beings who can bridge the systems. And we are just so blessed, sir, with your constant inspiration, constant motivation, that words are never enough to say thank you to you. But at the same time, we need to say thank you. So from our heart, on behalf of SITER, SBV, all the participants in this Yogina, which is being telecast also on Facebook, it will be later an edited version available on YouTube. We offer our heartfelt gratitude to you, sir, for being such an inspiring, humane being, manifesting the divine wisdom through you, sir. So thank you so much, sir.
I want 1 minute, Ananda.
Yes, sir. Yes, sir.
In Malaysia, you said you want to spread yoga therapy. There is to build a bridge, I'm using the same word which you used. If you want to build a bridge between SITER and Malaysian yoga therapy interested people, then you have to make it patently means visibly secular and acceptable. So my tactic will be to get an Islamic scholar who is enlightened about yoga and how it can be secular, and create like here they have, I think, Hidari or something. My Malay is not that good. There is a word for secular. Even the Islamic religion here, this practice called Hidari Islam. That means tolerates all other religions. It's not intolerant. So that way, there are Islamic scholar who is a Malay gentleman or a gentle lady will be able to get a name for that. And you have to put it, this secular concepts there and promote it as a Malaysian version of, here everything is Islam, seen from that national religious meaning. Even banking is called halal banking. It has to be halal yoga. For a better word, I'm saying halal yoga, because if banking can be halal, yoga can also be. So if you pack it that way, I'm sure it can pick up. Tamil schools are doing it now, but it is limited to minority of people because of this reason.
Yes.
So they think that some certain processes are strongly religious and not general for mind body only. So that part has to be sanitized to their acceptance. Then it will spread far and wide in Malaysia.
Definitely. A generic version of yoga therapy.
Yes.
A generic version of yoga therapy would have
halal version.
Halal version. I like that idea, and that would be a good idea, also contribution. So once again, sir, thanking you so much, thanking all our panelists, and thanking our audience for being with us. I think we close for today. We'll close with the Loka Samasta. Om Sarve Bhavantu Sukhinah, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Kaschid Dukkha Bhag Bhaved. Om Loka Samasta Sukhino Bhavantu, Sarve Janah Sukhino Bhavantu. Om Shanti Shanti Shanti. Om. Thank you very much, sir. Thank you, everyone. And it's bye for now. We'll come back tomorrow, 10:30, with many more amazing sessions for all of you. So stay tuned to the SITER channel. Thank you.
Bye.